everyone, I'm John Lind, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And today's guest is Dr. Erin Jospe from Worldwide Technology. Welcome, Erin.
Thank you so much, John. Thanks for having me here at Chime.
Yeah, so excited to talk about some interesting infrastructure topics that I haven't ever talked about before at Healthcare IT Today. But before we get there, tell us about yourself and WWT.
Sure. So by way of background, I'm an internist, but I've been in the healthcare IT space now for over a decade. And I previously served as chief medical officer at two other health IT companies. Wow. And recently joined WWT. And what really attracted me to WWT was not just their global footprint, but truly their prowess in not just thinking about infrastructure, as you were saying, but really about the depth of industry knowledge that they bring to the conversation. So it's not just pushing widgets and routers and switches, but it's really thinking about strategically, how do we partner with you as an organization? My particular vertical is in healthcare, and how can we really help you think about not just what your infrastructure immediate needs are, but long-term, how does that allow you to continue to innovate and build safely to reach people and create positive workflows.
So what are some of the big topics you're hearing from customers when it comes to infrastructure?
Sure. So I think one of the biggest areas right now is the mandates that are coming down, both within the organization and ultimately federally, around how to decrease carbon footprints. So thinking about infrastructure as an investment in how do you govern your data, how do you collect your data, how do you store your data, how do you move to the cloud? So strategically, that cloud migration fits into there. And then, of course, thinking about the data and the analytics that are going to be so important to providing that kind of insight to make your investments shine. So how are you using them? What are the other ways that they can be applied? In healthcare, I think one of the most interesting things is applying our digital prowess and expertise to creating really positive patient experiences as well as positive clinician experiences.
Oh, okay.
I think people have become much more mindful about infrastructure as something that can be a tool that is a hindrance or a tool that is really enabling. And as we're very protective of the healthcare workforce, being mindful of that. And so how can you leverage not just the technology, but also the people in the process to end up in a better place than where you started?
I don't think most people would have thought of like carbon offsets, green efforts, right, as a patient experience or a physician experience side of things. That's interesting that you're tying them together.
Yeah, well, I guess part of it is, when you're a hammer, everything's a nail. But I really think that it's important to bring that lens of ESG, that environmental, social, and governance initiative lens to the work that people are doing. So I would backtrack and first say that I think one of the most important things to come out of the last few years is a realization that everybody within the health system is in a position to touch that patient journey. And I think that's really an important thing to realize for a number of reasons. One, it gives everyone a sense of mission. Everybody really can impact the experience that someone has for their care and how they get better and how they stay better. And so for IT to also feel that, I think is really important. And I think it's really important also because it's really true. When we think about the impact that technology can have on an environment, so going green and decreasing your carbon footprint, it's really important when we think about local health because we know that health outcomes, the majority of them, over 80% of them, are due to the local environment that a person is in. And so thinking about what the impact of your technology, your data center, the pollution that you generate is really an important thing. And data centers, the statistic that I heard is that they're meeting, if not exceeding, the airline industry from a carbon footprint standpoint, which for me was kind of mind-blowing. And then when you think, well, who's going to care about that? It's not just the IT person that needs to care about it. Now we want to make sure that your chief medical officer is also aware of that because, again, those social determinants of health, that environment that someone is in, really does matter, and it plays a large part in how someone's going to fare.
Yeah, talk more about why a CIO should care, right? I mean, obviously they care about the community and some broader perspectives like that, but what are some more practical reasons why a CIO should make more effort in carbon offsets or reducing your carbon footprint?
Sure. So I think Part of it is thinking about the carbon impact itself, and part of it is thinking about outdated infrastructure and its contribution. And so those outdated hardware that assets that you have are both a security risk as well as a carbon generator. So how do we now think about something that maybe needed to happen anyway, making those changes, upgrading to that and finding the budget to do that, and also recognizing that that has positive beneficial impact to your environment. It's some organizations are setting some really aggressive goals around becoming carbon neutral. What's the part that you can play in that? I think is a really important way to begin to think and to begin to build those relationships within your organization for who else really cares about these things. And of course, the security aspect is huge. And I would say that that security aspect also plays into those ESG initiatives very solidly in the governance and compliance area.
Okay.
And we also want to make people feel like they can move the needle in that regard. And of course, there's making those investments in infrastructure that allow you to be really innovative about how you're going to engage your patient community.
Sure. That's true.
And I think that that's really important as well. So you want a strong core foundation on which to build, kind of like yoga that way, right? You're not going to be able to innovate unless you make those investments. And I think many can have some great ideas, but unless you have the infrastructure to support that, you really can't make it actionable. And so that's where I think you can build those alliances where you can have kind of an onion effect of many layers coming together to create something that's greater than maybe what you envisioned to begin with.
Yeah. That's great. Now, when we were prepping for this, you talked about the health equity angle of this, which I've never heard anyone talk about infrastructure as health equity. So tell me how you view that.
Thank you. I appreciate the opportunity to grab this soapbox. But health equity, when we want to start with just a common definition, right? So health equity is that opportunity to be healthy and well. And we know that not everyone has that same opportunity. We know from before, like I was saying, environment greatly impacts that. And so trying to improve and create a more equitable environment for people to be in, one with clean water, one with clean air to breathe, really does matter. Think about all of those chronic disease conditions where the environment is really going to come to bear and what those health outcomes are. But I would say too that health equity comes to bear in those other ESG initiatives beyond just the local environment. When we think about diversity and inclusion in your clinical trials, in your data that's being represented, as you try and analyze that data to come up with policies, which feeds into your governance and compliance area. So from a social standpoint, of course, this is something that everybody wants to get behind. But again, where does the CIO fit? And thinking about those data and analytics and thinking about the environment, and I'll make a big play here for the cybersecurity piece as well. So recently at Becker's, many bemoaned the fact that there are lots of folks that are coming at them with great ideas for social and environment, but there's not so much to say about governance. And I would say that cybersecurity is really the foundation there on which everything else can and should be built. When we think about the impact of identity theft, let alone at the hands of the hospital with a data breach or a ransomware attack, right? That is devastating because we want to take care of patients holistically, not just physically. So the emotional, psychological toll has been demonstrated to be disproportionate in people of color and in the elderly, so marginalized populations. We know that if you are already starting off below the poverty line, that is a hole that you cannot escape from. And I would also say that there are actual health outcomes. We need much, much more research to be done in this area, but we're starting to see health outcomes that are direct result, not just of the breach, but that carry over due to the remediation process itself. And so that's something that I think is very startling when we think about how are we handling a breach, that how we could do that might create obstacles to how people are going to experience care and what their outcomes are going to be. So again, it's that mindfulness of, do you have representation as you're having these conversations from a diverse population, diversity within your patient population, and then diversity of perspectives from those who are operational clinically being, I think, one of the biggest stakeholders that are often missing from that table, from that discussion. I once had a colleague who said, you never fail alone, and I feel like cybersecurity should be one of those things too.
That's true.
It should be an effort that is not limited to IT and IS, that really should go beyond, and to acknowledge that the care that patients receive and their ability to stay healthy and well is directly impacted by those cybersecurity decisions that you make and the investments that can be had.
That's a good point. You're only as secure as that really nice nurse that wants to help someone.
I know.
On the phishing email.
It's so true. It's so true. And it can't just be about training. Right? I think I hate to sound like it's the scent of inevitability, but there is something about just the massive number of attacks that are taking place. And yes, you want to shrink that surface area of attack. You want to do everything in your power to enable your employees to be good stewards of your security, but you also need them to be your allies in how you're going to function and remediate the process, so that it isn't all systems are shut down. It isn't millions of dollars a day while you're down. It's how can you keep operations as normal as possible with the highest quality of care provided for your community.
Yeah, absolutely. Well, talk about it from a vendor perspective. Like, how does all of this health equity, green movement, carbon offsets play at WWT?
So I think I would have to come back to our core culture. So our culture is very much grounded, and it's an offshoot of the fact that it is privately held. It's the largest privately held company by a Black African American man in the United States. And I think that Dave Steward really takes that privilege of having an asset like WWT to be an opportunity to make a better world happen. That's in fact our motto. How do we invest in our communities? How do we invest in our employees and really create that spirit of innovation, knowing that innovation creates such long-term goodness? I mean, it just makes so much business sense when you've got that kind of creativity being stoked and fed within your organization. So first, I would say it's our culture. And second, it's the investments that have been made all along in really being able to have and deliver on the promise of the best infrastructure partnerships out there. So being able to partner with the people that we do, and being able to leverage those partnerships to touch so many different industries, healthcare, of course, being my particular favorite, but being able to use that as a lever to make a better world happen, I think is what distinguishes WWT, and it's part of what attracted me to the company those many months ago.
Awesome. Erin, this was a lot of fun. I appreciate this. It was a conversation I didn't expect to have at the Chime Fall Forum, so thank you so much, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application.
John, thank you so much for having me. Really appreciate the opportunity to talk.